A 40-year-old male libido drop, how to fix it. Libido or sexual desire occupies an important part in the sexual life of both women and men. So how to cope with a drop in libido in the 40-year-old man? It is essential for a fulfilling sexuality. Libido is actually the unconscious search for pleasure and interest in sexuality. It is said that there is a loss of libido when the person totally or partially lost interest in any sexual activity. If previously we thought that the loss of libido concerned only women, men are no longer spared from this problem. According to estimates, the decline in sexual desire would affect more than 30 of men aged 40 and over. Specialists have long argued that the 40-year-old man's libido decline was age-related. As hormone production was declining, men would gradually lose their sexual appetite. But recent studies tend to show that libido depends more on physical fitness than on age, not to mention the different factors that affect male libido. 5 factors favoring low libido at age 40. The absence or decrease of desire in men can have psychological and organic causes. Diseases and problems within the couple can indeed affect the libido. But what interests us here are especially the origins of the lack of sexual appetite related to physical conditions. Here are 5 of these factors. Excess weight. Being overweight is one of the most common causes of loss of libido. Fat indeed lowers the testosterone level, yet very important to feel the desire. In addition, they increase estrogen levels. And we know that excess estrogen affects not only desire but also fertility and mood. Obesity is therefore among the first enemies of male libido. Poor blood circulation. The penis, or more precisely the cavernous body, must be gorged with blood to be able to enter erection. And of course, if the blood vessels are hindered by the plaque and fat, it becomes difficult for the man to feel the desire. Poor blood circulation is also bad for the libido. The lack of physical activity from the age of 40 can explain this sexual disorder once arrived at this age. Glycemia. High blood sugar levels cause hormonal imbalance. Experts say that blood sugar disrupts the interactions between the brain's brain controls. This phenomenon is called gonadotropic axis and leads to changes in the testes. As a result, they are unable to produce the required amount of testosterone that inevitably leads to the loss of libido. This is why men with diabetes often have problems with loss of sexual desire. But still very few patients dare to talk to their doctors. Medication. This sexual disorder is indeed one of the side effects of drugs such as hormonal treatments, anxiolytics, antidepressants, or the treatment of hypertension. If you are taking medication and find that your libido is at half-mast, it is always advisable to talk to your doctor about it in order to find a solution. The stress. Stress can also cause a drop in libido at age 40. Depression, fatigue and stress are indeed associated with a decrease in libido, and most of the time. This concerns both men under 40 years and above. Whatever the source of your stress, family problems, professional worries, critical economic situations. This psychological problem can reduce your libido to nothing. It is therefore important to find a certain balance in your life to improve this aspect of your sex life. How to increase your libido to 40 years. When you have problems with libido, the question you ask yourself is of course how to increase the libido man to 40 years. There are indeed natural tips to regain your sexual appetite. Starting with the maintenance of your fitness and your mental health. Healing your sex life can also bring positive change to your love life. In addition, sexual satisfaction improves your overall well-being. Play sports. Getting into sports activities on a regular basis is one of the first things you can do to boost the libido of men at 40 years old. This makes it possible to build muscles and improve blood circulation. In addition, the sport stimulates the secretion of testosterone and the decrease of estrogen. With the hormonal balance thus restored, the man will notice a significant increase in his sexual desire. In addition to improving libido, the sport optimizes the health of the body in general. You will enjoy all the benefits. Try new things. You can also try new things in your life in general, but also in your sex life to add spice. For example, trips can bring good changes. On the sex side, new positions and new practices will encourage complicity and libido. The best is still to discuss and improve the communication with your partner to put you together. Have a more active sex life. A more active sex life also helps to preserve your sexual desire. Specialists recommend having frequent ejaculations but not too much to get there. Having regular sex can only be beneficial for you and your sexuality. Take herbal supplements in rotation. Taking natural supplements in the form of natural herbs is also a good solution for dealing with men's low libido. Among the most effective are ginseng, tongkatali, mira palma, pine pollen, zinc, arginine and maca. However, alternate herbs to use only one supplement per day. Thus, they will remain more efficient.